Hey, what's going on? It's Eric Nordquist, Nordo from KFAN Radio, weekdays 9 to noon, and you're about to hear the most recent episode of Profiles in Health and Wellness. It's hosted by Marney Gellner. Love doing this podcast and producing it for Marney and Profile by Sanford. Not only did I have an immense amount of success utilizing the program, lost 50 pounds, following the steps, working with their nutritionist, following the plan, eating the food, and seeing great results with it. But it's cool hearing different perspectives from others working in different professional crafts who have gone through their own journeys, found their own successes and paths with Profile by Sanford in attempts to make that lifestyle change. That's really what it's about. Not a crash diet, but ultimately creating better habits and finding that long-term stability that we're all looking for. It's really cool. And this week, one of my favorite episodes is you can hear it from me. Hey, I lost some weight, and it was awesome. The food was great, super easy, et cetera, et cetera. But what about hearing from the Chief Medical Officer of UnityPoint Health in Des Moines, Iowa? Dr. David Williams is this week's guest with Marney Gellner, and you can hear all the customer testimonials and all the positivity you want, but when you hear a guy that is neck deep in the world of health, in the medical industry, and he is singing its praises, when you hear that his wife utilizes the program, that his daughter utilizes the program, that they're finding success, and that he is on the program as well, that should hopefully give you a pretty good idea in terms of the science and the research that Sanford Health put behind this thing, how strong it is, and again, how strong and high the viewpoints are among those in the medical world as to what Sanford and Profile by Sanford, what it can do for people like me and maybe people like you who are listening to this podcast. So without further ado, enough of me. Let's get to Marney Gellner and Dr. David Williams, this week's episode of Profiles in Health and Wellness.
So glad to have you with us on another episode of Profiles in Health and Wellness. I'm Marney Gellner. Our producer is Eric Nordquist, and our guest today is Dr. Dave Williams, the Chief Medical Officer of UnityPoint Health in Des Moines, Iowa. Dr. Dave, hello, sir. How you doing?
I'm great, Marney. Hope all's going well on your end.
Yeah, everything is great. Is Dr. Dave too informal? Do you prefer Dr. Williams?
I prefer Dave.
Oh, Dave. Okay. How about Dav? I'm going to just nickname it right now, Dav. No, we'll go Dave. It's nice to meet you, and I'm curious about your story, so I'm glad that we have some time to kind of get to know you first as a person before we talk about how Profile has helped you in your life. Your biography is, it's lengthy, and it has a lot of medical words in it. And part of the words say that you have worked in clinical leadership across the organization currently, and you have held these other kinds of leadership roles after serving as primarily a pediatrician. Can you sort of explain what leadership in the medical field and what your role is with that to us lay people who don't work in the medical field?
You bet. Marney, I think my most important background, professionally at least, is a pediatrician. So I spent 20 years in clinical practice really taking care of kids and families, and that's where my heart's at, and that's what I like the best. Accidentally, I got approached by my boss at the time, a medical director a long time ago, asked me if I'd consider some physician governance and physician leadership. Knowing nothing about it, I said yes. I was able to win my first election for one primary reason. I ran unopposed, so I had a pretty good majority in that race.
Well done.
But it just kind of progressed from overseeing clinics to overseeing hospitals to now kind of overseeing kind of the medical care throughout our regions and health system.
And with your background as a pediatrician, you have, I'm sure, seen and heard it all because kids tend to do that. Do you have just a love of kids and youth and all that comes along with that, or is that just part of the medical field that really interested you?
Absolutely, I have a love of kids, and what I really enjoyed was watching them grow up and watching the family dynamics change. And really the best part of my practice, even though it means I get old, is when you see somebody as a little baby who then graduates from high school / college. I even had a couple patients who then brought their kids to me and that was incredibly rewarding.
And the cycle goes on.
The cycle goes on.
There you
exactly.
go. Part of your biography also says on a website that I read that you like to take on a fitness kick every 5 years or so, that at one time you were a kickboxing instructor. At one point you ran a marathon because that was your kick at the time, and currently you're into biking. Is all of that pretty accurate?
Pretty accurate. I tend to go through cycles. I hope this is a cycle that lasts, by the way. Let's start there.
Mm-hmm.
But really kind of got into fitness in my 30s and got into running, which culminated in running a marathon. By the way, I was one of those guys that collapsed over the finish line, needed IV fluids, and almost to be hospitalized. So I don't see that in my future again.
Oh, wow.
Got into kind of a local fitness program that has now been franchised here out of Des Moines, Iowa, called Farrell's. And Farrell's has kickboxing and resistance band training. Did that for a while, and they asked me to be an instructor, so did that for 4 or 5 years. The main reason I got out of that is the only class time that worked in my schedule was either 4 a.m. or 5 a.m., and it just got pretty unsustainable as far as hours of sleep I was getting. And then really through work, met the Sanford team, learned about Profile, have been onto that, and in conjunction with that, bought a Peloton bike for indoor cycling and a road bike for outdoor cycling.
Well, there you go.
That's where we're at now.
You have all your seasons covered.
That's right.
When you say you came upon Profile as part of your work, I always think that when people in the medical field are on board with a health program, that the health program must be legitimate. And that's one of the reasons that I personally felt really safe, I think is the best word, in joining with the Profile, because it's tied directly to Sanford, to the Sanford clinics, to Sanford Hospital, to Sanford doctors. And you're telling me, as a doctor himself, that you learned about this in your field, and then I would imagine did some research or follow-up, and when you give it the green light in the medical field, that must mean it's legit.
Yeah, I would. First of all, you're very kind with that, but I do agree with that, and I certainly did do some research to make sure that this was a safe and an effective program. I was more lucky than most. Our organizations, UnityPoint Health and Sanford, were in discussions to become one organization for a while. So I got to meet Dr. Allison Suttle, who is the Chief Medical Officer at Sanford and the Chief Medical Officer for Sanford Profile. I can't tell you how greatly I respect Dr. Suttle and her opinion. And I asked her all kinds of questions, not only about me, but for my wife who's on the program and for my daughter who's on the program. My main worry was probably that it was just a fad ketogenic diet and that it wasn't really balanced nutrition. Mm-hmm. Allison talked me through that and showed me several articles and a lot of literature proving just how effective and safe this program can be. I would say, I think the highest kind of praise that I can give it is if I didn't completely believe in its effectiveness and its safety, there is no way I'd let my daughter do it. She has had tremendous success on the program as well.
And how old is your daughter?
She is 22.
22. What kind of success did you have, did your wife have, and did your 22-year-old daughter have?
My wife and I have been on the program since October 7th, to be exact. We both hit our goal weight in June. I'm currently, and I weigh weekly, I don't know exactly, but I'm currently somewhere between 82 and 85 pounds down.
Oh, my
gosh. My wife is down somewhere between 50 and 60 pounds. My daughter is down somewhere between 40 and 50 pounds as well.
Wow.
I like to
That
tell
is
people
tremendous.
I lost a third grader.
You lost a third grader, your wife lost a second grader, and your daughter lost a kindergartner. That's phenomenal.
That's a way of explaining it.
Is there a before picture that was taken, I don't know, September or sometime in the fall, and a picture now where you just marvel at the difference?
I don't know about marvel, but you're absolutely right. I have another daughter who lives in Seattle, Washington. We visited her and had the obligatory Facebook posts, and I think looking at that September picture was the trigger for both my wife and I to decide it's time to do something about our health. It's time of COVID, so there's a lot of people working from home, and I have people that hadn't seen me in several months, and they definitely remarked that I look different.
And I would imagine, being someone in the medical field who is often advising people on their health, that for you to be healthier, to look healthier, to physically show better health is really important for you personally.
I think it is, and it was absolutely an area that I was really self-conscious about. In my role, I do a lot of public speaking, and to get up in front of a stage when you obviously have a problem with obesity, it was difficult, and I was angry at myself for that. So it's been a great boost to self-confidence on that front as well.
And have you found yourself enjoying anything like the physical aspects of a summer, especially this summer when we are in a pandemic and most people's outlets is to be outside, to do something in nature? Have you found yourself being able to take or enjoy longer walks or, a canoe ride or something where you think, wow, 6 months ago, I don't know if I could have enjoyed this?
Oh, yeah. I love being outside, and I absolutely started out at this little 3-mile hilly trek that I started out walking, and it was hard back in the fall and winter months. Now I'm running anywhere between 3.5 and 7 miles 4 or 5 days a week. So definite difference on that aspect.
And how much easier is the biking that you've come to enjoy now in your latest health kick?
Hugely easier, both on the indoor variety with the Peloton spin classes and outdoors. One of our rewards that my wife and I did do is we upgraded our bikes. So some of it's because I have better equipment, but I think a lot of it's because of fitness and energy level.
Well, that is fantastic to hear. Does your 22-year-old daughter, the one who is on this program, you mentioned you have one daughter in Seattle. Does your 22-year-old live in town so that the three of you are able to see each other and get out and enjoy things as a group?
Yeah, absolutely. I'm super proud of her because she started this program. She just graduated from Iowa State University. She started this program at her second semester of senior year. And when I think back to my last semester in college, there's no way I would have the commitment to do this. Due to COVID, she is currently living in my basement. And we have for me, I think the biggest key to my success is my wife, and now my wife and daughter are also on this plan.
Yep.
And we used to be a family, particularly when my kids were all in college, that ate out a lot. And the fact that we hold ourselves accountable, can eat meals together, that's been a tremendous key to our success.
Yep, I agree. My husband was on the profile plan at the same time I was, and it was incredibly supportive, and you sort of felt like, hey, we're in this together. And if one of you had a bad day, the other had a good day, and you could lift each other up when you felt like, I just want that bag of Doritos, or, whatever your vice is, whenever that day came, I felt like it was super helpful to have a spouse, or in your case, a spouse and a child helping you along. So were there days when one of you sort of had to rally the other along the way?
Oh, absolutely. We're not perfect. I'm not putting myself out as being perfect by any means, but we get ourselves back on plan. There are absolutely days where I would rather have pizza, or I would rather have a beer, or I'd rather have chips. And my wife just kind of reminds me, get yourself grounded. As you know from being on the plan, if you do cheat, you feel, this is a medical term, you feel like crap. And it's no fun to feel like crap. You feel a lot better when you eat what your coach tells you to.
Agreed. Did you all have the same coach or have different coaches?
We go to the same location. I have a Coach Shayla at our West Des Moines location. My daughter and wife have Coach Nikki at our West Des Moines location.
Okay.
They work together. They email us jointly. They're both fabulous.
And I would imagine with some of the profile shakes and bars, when you have 3 different people on the program, you got to sample a lot of the different flavors, and somebody brought home the cauliflower toppers, and somebody else was trying the pasta sauce. And did you get a good variety of sampling between the three of you of all the food and options that are on the Profile program?
Hey, there's another benefit of having a couple people on it. You're
There
right.
you go.
There's all the variety. And I will say I've been incredibly impressed at just the flavor and the fact I haven't come across anything that tastes bad yet. If you would have told me a year ago that I would be addicted to cauliflower toppers, I would have never believed you. But it's high-quality products, and they taste good.
And here you are, down in your cauliflower toppers as you head out on your bike ride.
Yeah, there you go.
Fantastic. Well, Dr. Dave, or Dave as I've gotten to know you in the last 20 minutes, what a fantastic story. What a success story for you and your wife and your daughter. That is absolutely tremendous. Congratulations. You all must feel wonderfully proud of yourselves.
Oh, thank you so much, Marnie. Very proud of my wife and daughter and feeling happy for myself, too.
Fantastic. Enjoy the rest of your summer, Dave, and thank you so much for taking time to share your profile story with us.
You bet. Have a great day.
That was Dr. Dave Williams, the Chief Medical Officer of UnityPoint Health in Des Moines, Iowa, who has a tremendously successful profile story. And we thank you for listening along with us on this episode of Profiles in Health and Wellness.